Complaints by patients to the Singapore Medical Council against their doctors will be processed faster with a new inquiry committee which will filter grievances in just 3 weeks. Now, this is one of the preliminary recommendations by the work group formed to review the taking of informed consent and SMC's disciplinary processes. Updating the proposals, Senior Minister of State for Health, Edwin Tong, said there should also be clearer guidelines and codes for the medical profession. He said the SMC Ethical Code and Ethical Guidelines, or ECEG, are overly detailed and prescriptive and need to be improved.
The proposal is for the ECEG, the code itself, to be pared down to several core irreducible principles that outline the parameters of practice and our ethical boundaries. They will be binding on all doctors. At the same time, there will be an explanatory guideline or handbook that will contain illustrations, guidance notes, and so on, that will be developed with the medical community.
Mr. Tong announced these proposals at a medical congress. He said it is tricky to find the right balance in the doctor-patient relationship, and instead of practicing defensive medicine, doctors should trust that the system they operate in is fair and transparent. Believing that 4 in 5 complaints have more scope for mediation, Mr. Tong said his ministry will be working with organizations like the Singapore Mediation Centre to provide the expertise. He said once a complaint is not resolved for a long time, the party's stance tends to harden and mediation will help catch it early. Mr. Tong added that to lend more certainty to the process, doctors need to understand clearly what the parameters and rules are, and in that context, should they flout them, there can be no objections. The recommendations come after several high-profile cases of doctors were perceived to have been unfairly punished. They include orthopedic surgeon Lim Lian An, whose fine of $100,000 was set aside by the High Court in July, and psychiatrist Su Xuan Chiang, who was fined $50,000.